Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Well, good morning.
So you're here this morning.
We are
You're
here.
not away for the weekend yet.
I'm not away for the memorial. No, I'm working today, Anita.
I know you are.
Yes,
Because
a lot of people taking a long weekend. No, we are working. We are not letting our clients and patients hot and dry.
hang out.
Right.
You know, they have to go and do that. And I just have to appreciate you that you understand that why when people are in a long weekend do they get sick? Is what happens to them? Is it the mental that they don't think, where am I going to be able to go if I get sick?
Sometimes what happens is we don't plan. So long weekend is coming. Do I have all my pills to cover me over the weekend? Do I have any concern that I cannot wait until Tuesday next week? We don't plan, so we let things be, and we say we're going to be okay. One of the reasons that make me open on Saturdays was the fact that when I used to make rounds to the hospital, you know, when I opened my practice, I used to cover 9 different hospitals. 9 different hospitals.
I believe it, right, in your
So
in
I
your
will go
helicopter.
emergency room to emergency room, start 3 o'clock in the morning to make sure I get the work done. Was working in West Palm Beach and Broward County, East and West, because most doctors, they are either East doctor or West doctor. So a lot of them will be surprised. They say, oh, my God, you go East and West? I say, yeah, and I go North and South, too. So
how you build a business.
So when I used to go to the emergency room, Monday through Friday, they were not that busy.
Yeah.
Monday through Friday, doctors are open. And then Saturday and Sunday, the ER will be packed with people. And for simple thing, a UTI, a little dehydration, they get some fluid, sent home. The other one get a intravenous antibiotic and sent home. But I say, wow, this is costly because elderly patient with a little UTI can become confused. So then here come the CAT scan of but I'm having shortness of breath. Let's do a CAT scan of the head and the chest. And because of the shortness of breath, I have to do an electrocardiogram. You know, and if it's a person that can walk and talk and move and complain, I'm here for my urine, not for my head. Treat my problem. So that was one of the things that motivated me to work on Saturday. The other one was the fact that those centers started opening, like people that have urgent, so those urgent cares.
Right.
Let's call them. Those urgent cares started opening, and the patient will go, it's like they don't know me from a hole in the wall. And they gave me the wrong antibiotic, and I told them I was allergic to this, and they gave me that, and they come with the rash and the other complication of the. They come with a rash with the other complication related to the simple condition that they develop. So that made me say, let's open Saturday, but we want to remind our audience that it's going to be a long weekend. So Monday is an official day off. So Sunday and Monday, we will not be open. So if you know, you come to our practice, either Boynton or Fort Lauderdale, you know that you need any medication, you feel that you're having any symptom, just come right in. We'll stay open as long as patients are coming in, and then we'll be closing hopefully by half a day. But if we need to extend... And I
want to talk, though. I want to tell everybody, though, I've recently met some people that said they have this toothache. And I said, well, you need to go to the dentist. I know, but there are no dentists open. And this is always the weekend, right? Mm-hmm. But the interesting thing is they've been suffering with that tooth all along. And I want to ask you that. And what is it with people that they have a toothache and they don't go to the dentist?
That's Russian roulette. That's Russian roulette. Because what happened, you have a toothache, it's a sign telling you that something is wrong with that tooth. And when you let it go for whatever reason, you just let it go, you will have the opportunity of developing an abscess. And if you develop an abscess, you have to take that tooth out. You don't have any other choice but to extract that tooth. So if you have a little toothache, it might be a cavity that can be treated, and you go home and you keep your teeth that are there to, outlive you.
So you're
Dental are there
open,
to
but you're
outlive.
open today.
We are
with
open.
the dental
Dental is
department
open
that
today.
they can come.
They can
so
come.
You need to go and do that. And, and now we need to introduce our wonderful guest who's come from Aventura, Debbie Korman. She is someone that you really appreciate.
Yeah.
She owns the Senior Spot, which is not a nightclub. Well, maybe some of the older adults would like it
It's
to be
their
a nightclub.
nightclub,
Why
yeah.
not? Maybe you need to add the name
It's the-
nightclub, Debbie, and get
it's
people
the-
to come, right?
Yeah.
That's a good idea.
Why don't you
Instead
tell
of-
people?
That's
Is
a
the-
good idea.
The nightclub on during the day.
That's right, the nightclub, the day club.
Yeah, the day club.
But maybe that's a very good name, the day club,
The
rather
day
than
club,
daycare.
yeah.
You know,
Day club.
Dr. Mencia was just talking about, in passing, about a UTI. And I wanted to bring that up because UTIs are a very common problem with the older generation. And a lot of people neglect a UTI. And what happens is the patient ends up in a hospital. They end up having to have a lot more care than is needed. And I think a UTI needs to be addressed early. And I think, am I correct, Dr. Mencia?
Absolutely.
And I think that they need to, I think it's a simple medication that
It's
they
a simple pill
yes,
they can
very
take.
simple. And if it's not addressed early, it can cause a lot of problems. And they end up in the hospital and they end up with serious issues. So I just wanted to bring that up.
I just had a patient that was
Why don't you say what a
He has
UTI is for someone
a
today?
urinary tract infection.
Okay.
And, I had a patient that husband and wife, they were going to Colorado, and the wife developed cystitis, which is, the infection of the bladder only. And the husband said, let's go and see Dr. Mencia before we go. Don't go like that, And because they are traveling, they are going to Colorado, the altitude and all of that. Not only I put her on antibiotic, I gave her an injection of antibiotic. I said, we're going to give you an injection of antibiotic that is not common in a regular cystitis. You just treat it with antibiotic for about 3 to 5 days, and you are done. But this person was traveling. It's going to get on a plane.
Smart.
Just by being on a plane, we all, regardless of the age, increase the risk of dehydration.
Yes. Mm-hmm.
So, it is... If you are traveling, don't just go to the doctor and say, well, I have a little burning sensation when I pee. And no, I have a burning sensation when I pee. I want to check my urine. And by the way, I'm traveling to Europe tomorrow, so that the doctor can be more aggressive in treating you as a patient.
Well, I just want to say that I know, Debbie, when someone comes to your center and they complain, then you will know that what this is, and then you would
Yes.
direct them to go to a
Yes.
doctor.
And a lot of family members are neglectful. And that's a big issue. It's a very common problem. And I think people need to look at it quicker and address it much quicker so that the patient does not have to end up in a hospital, end up with more serious situation than what she actually would have. I think generally you can address it at home with pills unless you neglect it. If you neglect it, it becomes a serious issue.
So, Debbie, the reason that I want to bring this up with you is because you didn't just open up this senior daycare. You come with a lot of health experience, don't you?
Yes.
Why don't you share that?
I worked for 12 years as an administrator for an assisted living facility in Davie. The woman who owned the facility is the best, I think, in the industry. She's a very hands-on person. She never sat in an office. She was on the floor all day, every day. She never missed a meal. It was very important to her what they ate. The lifespan of the resident was very long. She had one woman there who lived 18 years and died while I was there, and that's unheard of in this industry. I think usually it's a 2-3 year lifespan. So I come from an assisted living. I learned a lot from her. I worked over 10 years there, and it gave me my jump start. That's basically it.
And so you must see, and you're unusual. A lot of people who worked for a long time in an industry like that say, that's it, I'm not doing it anymore. But you must really love older adults.
I really liked it, and I came from a completely different industry. And in Canada, I worked in the jewelry industry for over 20 years. And I came here, and by accident, I ended up in assisted living. And I really did like it. I didn't think I would like it, but I really did like it. You have to like the people. If you don't like the patients, right?
You have to have a kind heart.
And you have to like the people. A lot of people don't. And if you like the people, you'll love your job. If you get to know the dementia, Alzheimer patient, they're beautiful. They're full of life. They might not remember things, or they might not know people, but the characters are there, and they're really very nice people, and that's basically it. And I love the industry.
And so, just to let people know how they can meet you, and do something.
Yes.
Her name is Debbie Korman, and she owns the Senior Spot, which we're going to call the nightclub. And it's an adult daycare senior. If you told them they were going to a nightclub, they'd go. Don't take me to a daycare center. I want to go to a nightclub, right? So you have to have some bongos at the front. Anyway, located now, it's at 410 East Oakland Park Boulevard in Wilton, Manors. Very, very good location. It's a block from Publix and Primanti Brothers with the pizza place. The point is that don't leave your loved ones at home alone. Please, I beg you. You have to get them somewhere, and somewhere they enjoy. And I know you can hear how passionate Debbie is. Let me give you a phone number if you want more information. Remember, this is Pencil Talk Radio. It's 754-223-3479. And they're on the web at theseniourspot.com.
I also want to interject and give you my cell number, which is the best place to call me because I'm always on the road.
Okay.
And that's 305-988-0368.
Okay, so we'll repeat that in a little while. So, Dr. Mencia, you know Debbie, and you've asked for her to come on your show, and you don't do that casually.
Right.
So you must believe that this is a very good idea.
Well, not only is a great idea, it's a needed service.
Yes.
It's a such a needed service. And I can tell you because we do home visits. And, there are people that can be on a day club, let's call it, not daycare.
A day club, yes.
They can be on a day club where they go with other seniors. They see, they play, they sing, they get a snack. It's a whole day of activity. Keep them busy. Now, especially if you have Alzheimer's disease or Parkinson's disease, if you have any of this condition, the more active the brain is, the greater the chance of longevity on those individuals. Mm-hmm. So, because you have Alzheimer's, if it's your loved one, do you want them just to die on you? Do you want just to let them fade away? No. And if you read about Alzheimer's and prevention and protecting the brain, the portion of the brain that is working is by keeping the brain active. Not by sitting down and putting a TV on. You fall asleep, you close your eyes, and the TV is watching you. You are not watching TV any longer. So, when you go to a daycare, they let you take your naps. But Debbie's there to make sure that day is spent productively for the person. Keep the brain active.
I'm sorry to interject. I wanted just to say I completely agree with you. In assisted living, the activity was nonstop. It was a full day of activity. Sometimes people dozed off, but they were allowed to doze off.
Of course.
But then they wake up and they do an exercise or they do a word game and they'll fall back asleep. But the activity is very crucial to their well-being. It keeps them alive. It keeps them healthier for a longer period of time. And I really do believe that it keeps the disease stable. So that you see that a lot of people tell you when you speak to people who have a dementia-ridden patient at home, they might tell you that, there's been a big decline in her. You don't really hear that from a very good facility. And the reason is the activity. At home, they put them in front of a TV. They watch TV, like you said, and a TV's not entertainment. And in a very good I'm losing my mind.
No, but I was just thinking as you were talking about that, Debbie. They also get bed sores when they sit all day.
Yes, and
Right.
that's
Very,
a problem.
very bad. Right.
And you're not allowed
And they get
to.
swollen ankle.
Yeah, exactly.
Yeah.
And
And
then
you
they
know-
If
fall
they have these
because-
chairs, they can
Right.
still get the bed sores because they
Yes.
don't move around.
And the
Right.
bed sores are a problem because you are not allowed to accept in an assisted living a person with a certain type of bed sore. If it's a level
Absolutely.
2 or
Yeah.
something, it has to be a level 1.
They have to be checked out.
They have to be in nursing homes.
It's very
It's
serious.
a very big problem.
So you really have prevention. And let me give everyone Dr. Mencia's information
Okay.
so they can go there today. Get there. They'll be open at 9 o'clock. You can go there and do it. It's the one that we're going to talk about is in Fort Lauderdale. It's at 1608 East Commercial Boulevard. The phone number to call is 954-489-1345. 954-489-1345. Now, they do have the home visit services available for homebound patients, but if you can get out, it's a wonderful thing to go to the doctor at the office. But if you can't, you're in a very serious way, you can call them and ask for that. Let me also give you their website. It's agifl.com. It's funny. We've done the AGI so long, I forget what it originally was. Adult Geriatric Institute, right? We've gotten this AGI. And also, I don't want to forget about the
But you
Stonewater Med
hear
Spa.
people talking about, they say, oh, I went to the AGI in
I
Wilton.
know, it's easy to remember.
The name
it has
settled in
But
the
I don't want to
community.
forget the Stonewater Med Spa.
If you are home and you have a long weekend,
Absolutely.
and you want to go and pamper yourself,
Today, they'll be
you
open.
You can go, and
They won't be open
today.
Sunday and Monday, but they'll be open today.
Today.
And that's Stonewater Med Spa. And that's over on Park Boulevard, very near the
Very
senior
near
spot,
senior
right?
spot.
Yes.
And their number there is 954-561-8799. Remember, this is Pencil Talk Radio. Write these numbers down. Let's get back to Dr. Mencia and to
for
Debbie
those,
Korman.
a lot of the patients that they do receive our magazine.
Yes.
Boomer Times. Debbie has a nice article on the May edition. So
Yes.
if you have the May edition, just go to page, I think it's 4.
Yeah.
Page 4 or 5.
Page 4 and 5.
And,
Exactly.
I got top billing.
Yeah, you really did. It's a very nice picture. But, Debbie, I really admire you because this is a wonderful opportunity. It's a new business for
Yes.
you in a sense, but that's why you're so passionate. And you will make a good thing of this. I want to know, how many people could you care for there?
Well, we're licensed right now for 20,
Okay.
and that's a limit.
Yeah.
I'm technically allowed 66, and that's from the state. But unfortunately, the city overrides
Okay.
the state.
But at least 20.
20
At
to
least
start.
20,
We
right.
know 20 would
20
be a
to
good
start.
And so when the people come in, they're what kind of their chairs and tables and everything's
yes,
organized.
we have chairs, and the dining room chairs all have arms. The everyday chairs all have arms. I have a few recliners. I have some chairs that I don't think would be good for them, but they're there anyways. But they'll be busy all day anyways.
Can their family members come and be with them if they want to?
Yes, but it's not a good idea. And generally speaking, a dementia patient will act differently, and Dr. Mencia can agree with me. Will act differently in front of their child or spouse than if they were with strangers. It's the same thing as if you send a child to school. The child acts differently in school than he does with his parents. And I also wanted to talk about transportation. What is available to the customer is TOPS. It's a very good Broward County service. It's less than $8 return. They pick you up, they drop you off. It does take a little time to do it. Takes, I was told, 2 weeks, but I would assume a little longer because it's government. And but it's once it's set in place, it picks up the person in a secure environment. It drops them at the daycare, and then it picks them up from the daycare and drops them back home.
That's such a wonderful
But
thing, isn't it?
some patient can qualify for TOP without paying for it.
That I don't know yet.
Yeah, I think some people, if they have, let's say, Medicare, Medicaid, and their level of income is a certain level, and they are unable to take public transportation, there are certain things they go through and then there's a form that you filled out, and then they bring it to me, and I sign that form for them, and it gets submitted back, and then those people get picked up and dropped back. The thing is, you have to call them always 24 hours in advance. But when it's something like this, Monday
Regular,
through Friday,
5 days a
or
week, sure.
Yeah.
6 days a week, or 5, or whatever day the
It's a
family
great
wants.
service. It's
It's a great service, and they are well known all over.
And they will take people a lot of other places too. I think they pick them up. They take them to the
Yes,
grocery store.
right.
I know exactly the kind of service we have that up here, and I know they have it in Miami-Dade. But what I wanted to, I think this is a very important discussion. But I have to jump in, even though Thompson may be great. You know, if a family has an older adult living with them or near them, they need to take them to you.
Yes.
If they can't get this TOPS or they don't want to, listen. This is your loved one. This is your mother, your father. Take them. Then just think, all day long you're going to be safe and secure knowing they're in a good place, this wonderful nightclub that they're going to, or day club they're going to be
Day
in.
club.
Right, the day club. I really like that name.
Yeah.
This, anyway, the TOPS, we call it TOPS Day Club. No, I'm sorry. Anyway, I'm just being funny, but I'm really serious about this. This is your responsibility. I feel very strongly about this. Take them. Pick them up.
And it doesn't have to be Alzheimer. Let me
That's
tell you something.
exactly.
It does not have to
Thank
be
you.
Alzheimer. I have a new patient that came to see me this week, and I was telling the son-in-law brought him in about Debbie and and her services. The patient is 101 years old, 101,
Oh,
very competent. The daughter and son-in-law live like 2 blocks away from him. So it's not too far. They are very close to my office. The patient used to have a girlfriend on the west side. So he used to drive there out west every day.
How old was he when he drove there?
It was only until a few years. She just passed
So
away.
about 100.
Yeah, 98.
God.
He still can drive.
God.
Today he still drives.
He still drives?
He still drives to the supermarket, go
Oh, my
back.
God.
He still can drive and all of that. But the worry that the family is having is that they don't know if he's taking his medication right, if he's doing the right thing, if he's eating right. And I would say, you don't have to be demented to go to
exactly.
an adult
No,
daycare.
exactly.
He can have so much fun
He likes
there.
ladies, so
He likes
you
lady.
see, it's a perfect place because
Exactly.
there's a lot of interaction there.
Exactly.
And there's a lot of supervision. So you make sure, you can see there's people who are in many assisted livings who don't eat. A plate of food is put in front of them and they pick at a lettuce leaf. So it's a very serious issue, Dr. Mencia, and one that has to be addressed. And I think that if you put them in an adult daycare, which is supervised, you know that they're eating. And that's very important because if they live alone, it's a problem.
But your point is well taken. Let's not talk Alzheimer's and any of the dementia.
Yeah.
Let's talk about a person that just needs to be with other people.
To be with
Yes.
other people.
And so I want to give Debbie's cell phone. It's 305-988-0368, and they're open 6 days a week. And Debbie Korman is very experienced, and she is really dedicated. And we hope that if you do have a parent or a loved one at home, don't leave them at home this way. It's not fair. Do what you want. It's the golden rule. I've been writing a column every month now on caregiving. It's the golden rule of caregiving. And let's get them
Absolutely.
into something that's really nice. So we have just a minute or two, Dr. Mencia, and I want everyone to know they need to go down today, get your services, whatever you want, your medication, anything with your dental. Just go and say hello.
And your facial.
Oh, you have so
your,
many things.
Your nails and whatever.
That's right. Stone water.
Didn't the half hour go by very quickly?
It always does.
Oh my
It
goodness!
When you
always
think
does.
about
We
it-
have so much fun.
It
That's
went
why
by so
I love
quickly.
coming here.
Yeah, and I love
I love being here
but
with Anita.
that's why
Just
people
so
love
much
this
fun.
because they're at home, they don't know what to do, and they listen to our shows. They learn, they feel good when we get finished, right?
Yeah, that's
a
what
lot
I
of
tell them. Go ahead, you try to sleep from 7 to 7:30. Just turn on the radio and try to go to
You
sleep.
won't go
See
to
what
sleep.
happens.
So that's it. Well, thank you very much, both of you, Debbie, for
Thank
coming
you.
in,
Thank
and
you.
Dr. Mencia. Have a great Great day today, Saturday, and we'll see you next week.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.